Facelifts are becoming increasingly popular, and over the last few years there have been a number of improvements in techniques to make it a safer procedure. Traditionally, facelifts have always involved lifting up the skin and tightening up the tissues deep to the skin. The big problem, of course, being that there are some crucial structures there, such as the parotid gland and a nerve called the facial nerve, which is the nerve which results in movement of the face. Now, the more modern techniques, such as the max facelift, is a short scar version of the original facelift, leaving a small scar which extends from in front of the ear to just behind the ear, and the elevation of the skin of the cheek or of the face is much less than before. This means that the overall procedure is much safer, the facial nerve is protected, and we use two sutures which are called the cranio-suspension sutures, which are used to tighten the tissues and to give you the lift, which is part of the procedure. Preparation for facelift really just involves Preparation for the facelift involves the patient being at their best possible health. I think, again, if patients can make sure that they are at their best weight and are not taking any medication which may lead to bleeding, such as aspirin and even some of the homeopathic medications, such as vitamin E and ginkgo biloba, and even garlic to some degree, then the chances of bleeding during the operation and following surgery is far less. Facelifting operation is an operation whereby an incision is made in front of the hairline and then in front of the ear and extends to a slightly bit behind the ear. The skin is then lifted up in front of the cheek and pulled in an upwards vector. This is distinct from the older style of facelift, where the vector of pull used to be in a backwards direction, and the appearance that you may see in some photographs of the so-called windswept appearance is of the old style of facelifting, where everything was pushed backwards. Nowadays we tend to go anti-gravity and lift it upwards, but that of course needs us to support the tissue on a structure. And this is where the max facelift, which is what I tend to use in the vast majority of the younger patients, comes into its own, because it uses permanent stitches which are stitched to the deep tissues and then elevated and maintained on the cheekbone, which is just the process just that you can feel just underneath the cheek on either side. Following facelifts, a patient can expect a degree of bruising and swelling. The bruising characteristically is just under the eye, even though the eyelids may not have been operated upon, and in the neck. You very rarely see bruising in the cheek area. You will also have some degree of numbness, which is classical and lasts for up to 2 to 3 months of the whole skin area. This can be a little bit worrying to patients, but if they are aware that this is natural and normal and will return in time, that is usually sufficient. Very rarely there may be a degree of weakness, often of the upper lip, but that is usually as a consequence of the local anesthetic which has been used, not so much the surgical technique, and should recover within 24 to 48 hours. Risks of a facelift are split up into the early and the late risks. The early risks are those associated with the operation, and the commonest one there is probably hematoma, which is a collection of blood under the skin tissue. This will require a return to theatre usually for releasing of the hematoma, but only really occurs in about 1 to 2% of patients. The more commoner long-term results or risks following surgery relate to ongoing numbness of the skin, which is more usually a common feature rather than the risk. But I think one needs to be aware too of the potential for facial nerve injury and weakness of usually the corner of the mouth, or a slight elevation, a slight droop of the eyebrows. It's rare for wounds to become infected, but again, the people who smoke a lot are at higher risk for developing problems, and this is much more common in the more extended facelift where the scarring may go behind the ear, and it's usually this part of the skin which suffers and causes healing problems.